And the inferior vena cava or cava, you can say. The main difference between arteries and vein, when we talk about arteries carry blood away from our heart, like you can say this is the largest artery, aorta. Okay, this is the abdominal aorta, so carrying the blood away from our heart. But when we talk about veins, carries blood towards our heart or transport the blood towards our heart. So when we talk about vena cava, of course vena cava is the largest vein in our body. There is superior vena cava and the inferior vena cava, but we should know today we are going to understand how inferior vena cava is formed. Okay, and it is going to carry blood from which part of our body. When we talk about the term, okay, inferior, so this is diaphragm. Okay, this is the diaphragm, a muscular structure, very important structure, which is of course involved in the inhalation and exhalation when we talk about the breathing. Okay, so inferior to diaphragm, when we talk about diaphragm, inferior to diaphragm, it means transport the blood. Inferior to diaphragm when we talk about our abdomen region, when we talk about our GIT, or we can say small intestine, large intestine, pelvic region, our lower limbs. Okay, so transport the blood from, or we can say inferior to diaphragm, and pour the blood into the right atrium, inferior vena cava. Okay, and the superior vena cava, it means from superior to the diaphragm. Okay, superior to the diaphragm. So like superior vena cava is going to transport or carry the blood from our head, neck region, and from our limbs, and of course from the thorax region also. Okay, that we will discuss later, but today we are going to understand the inferior vena cava. So the inferior vena cava, you can see here, this is the common iliac vein, this is the right common iliac vein, and this is the left common iliac vein. You can say this is the, of course, the artery, or you can say iliac aorta, iliac artery. Yeah. So this is the left common iliac vein, and this is the right common iliac vein. So right and left common iliac vein joins to form the inferior vena cava. This is our inferior vena cava. Got it? Now here is also lumbar veins, which is not visible here, but the thing that we should know is the gonadal vein. Can you see here the right gonadal vein, which is joining, or which is you can say directly connected to the inferior vena cava. Okay, this is the right gonadal vein. Gonads, it means testis in male and ovaries in female, directly connecting or joining the inferior vena cava. Got it? But when we talk about the left, okay, this is the left gonadal vein. Left gonadal vein is not directly connected to the inferior vena cava. Okay, left gonadal vein is connected to the left renal vein. Got it? Are you getting my point? Left renal vein. Of course, renal vein, it means we are talking about the kidney. So this is the left renal vein, and this is the right renal vein. Right renal vein is short as compared to the left, because we can see here the vena cava, or the inferior vena cava, is little bit, we can say right. This is the midline, so towards the right. That's why the length of this left renal vein is longer as compared to the right renal vein, of course. Got it? Okay, so this is the gonadal vein, left gonadal vein, right gonadal vein, ultimately joining the inferior vena cava. But the left gonadal vein is first, we can say, connected to the left renal vein. So renal vein is very thick. Why renal vein is very thick? Because we know the function of our kidney. So kidney, it means filtration of blood, removal of nitrogenous waste, formation of urine. That's why a large amount of blood is entering and leaving our kidney. Okay, now one more thing, you can see here this gland, suprarenal gland or adrenal gland above our kidney. Okay, one pair. So this is the vein, we can say suprarenal vein, and this suprarenal vein, okay, is first joining the left. This is the left suprarenal vein, left renal vein, and then this inferior vena cava. Okay, but when we talk about the right side, okay, right renal vein, this is the right renal vein, and the right suprarenal vein is directly connected to the inferior vena cava. It's very close. here it's very, you can say it is connected to the left renal vein and then inferior vena cava. Got it? Now one very important point here is that this is the inferior vena cava, of course. Now you understand how it is formed. And inferior vena cava, this is, you can say this is our heart and this is the right atrium. So this is, here is the inferior vena cava. Now kidney, retroperitoneal. So you can see here, this is our large intestine. Got it? This is our large intestine. So the blood from our GIT, from our small intestine, from our GIT, from our stomach, even we can say from the pancreas also, is carried to liver first and then to our heart. Is carried to liver first through hepatic portal vein, hepatic portal circulation or system, we can say. So this is our largest gland, liver. Liver is one of the most important gland in our body, having a lot of function. You can say more than 300 or 400 function, that not okay, 400 function, okay, but this is the largest gland in our body. Liver 1.5 kg or even 2 kg in adult. Now can you see here, this is the inferior vena cava. Hepatic veins, 3 hepatic veins joins the inferior vena cava, and then this inferior vena cava, okay, pour the deoxygenated blood into our right atrium. Okay, so now you can understand that the blood from the GIT is not directly poured into our heart, it is directly, it is like first carried to our liver through hepatic portal vein, and then to the right atrium. Got it? Okay, so we understand the inferior vena cava, inferior to diaphragm, and superior vena cava, superior to diaphragm.